Hi there, Dr. Andrea Shanowski from Health and Horsepower. And this week I'm really excited because I have had so many patients that have been bringing their children in with this issue, and they are frustrated and they're confused as to what's going on and why, when they're going to their doctor's office, the only thing their doctor is giving them for their kids is a medication and no information on what they can do to help the situation. So this week we are going to be talking about constipation, not just in kids but adults too, but kind of similar things are going to apply for both age groups. So when it comes to constipation, we have to realize that constipation, a lot of times, especially when it's chronic, you're going to have what's called fecal impaction. That means that the feces, as it goes through the intestine, tends to ball up and we get large balls of fecal material. And that is going to actually stretch the lumen or the size of the intestine. So what tends to happen is over time, as we get that constipation, as we get that fecal impaction, that large ball stretching the walls of the large intestine, eventually we get weakness in the walls of the intestine so that those muscles in the wall can't effectively compress and push the feces through the intestines, and that can cause even further issues with constipation and further issues where their body is just not able to push that through. Traditionally, when it comes to medical care, a lot of times when you take your child or yourself to your doctor, the doctor is going to recommend a medication like Miralax or X-Lax. Now, let me go into some of the cautionary things and some of the things to think about when it comes to both of those. So Miralax works by basically pushing water into the intestine so that it softens the stool so that kiddos can push that out or adults can push that out. Here's the thing, it's not FDA approved for use in children, even though it is very commonly used and recommended by doctors to kiddos. Now, one of the things we have to realize is that when we don't have enough testing on children, we don't really know what side effects or long-term effects that has on the kids and taking that for the long term. I know the FDA has had some adverse events reported, over 14,000 adverse events that have been reported based upon prescriptions of Miralax. Now, some of the adverse events that were reported were things like mouth ulcers, mood swings and aggression, seizures, and also suicidal thoughts in kids. So just a caution, Miralax is not good to take long term. It is also not FDA approved for use in children because we do not have enough studies done. And frankly, adverse events in kids and having some of those symptoms in your kiddos when they have constipation can be a little scary to think about. And again, if they're having health issues, we want to help them, not damage them more or see side effects that could be more of a problem than the actual condition they went in for. The other medication a lot of times that is also recommended is X-Lax, and that basically works by stimulating the muscle of the intestine to push the stool through. So basically, most medical treatment focuses on just cleaning it out. So putting water in there, squeezing the muscles, which, let's face it, X-Lax, when you have that kick in, can be pretty painful because you're getting those muscles kicking very quickly, very suddenly with a lot of strength to push that through. So again, medical model typically focuses on cleaning that out. The problem is if we have stretched the walls and the muscles aren't very effective, it can be very painful because those muscles don't necessarily work together properly or in the proper order, because normally when you're looking through the intestine, it's kind of like a tube. So your muscles are working to push, kind of push it through the intestine so that it exits properly. But if you have the walls of the intestine stretched, if the muscles are weak and not working together properly, that Miralax and X-Lax may not exactly work how it's being recommended and actually can make things more painful and more problematic for your child. So what I want to do today is talk a little bit more about some of the other situations that can be contributing to constipation and some of the other things that you should get checked out. We're also going to talk about some better options with less side effects and some things that you can do at home to help with constipation. So number one, I want you to realize that your digestive system literally goes from your mouth all the way down to the other end. So there's a very big system. I'm going to do an overview in a little bit on that digestive system and kind of what that looks like and some of the things we can see problems with. But let's start with talking about the fact that every single cell, muscle, and organ in your body is connected to nerve function. In order for that organ to work properly, we need 100% nerve function working. So if we have any nerve pressure or irritation going on in the spine, whether that is in the neck affecting jaw motion and chewing, whether that's between the shoulder blades causing issues where our stomach isn't working and digesting things properly, whether that's a little further down below the shoulder blades affecting liver and gallbladder function and your ability to actually break down and absorb nutrition from your food, or if there's issue in the intestines, the smaller the large intestine where they're not moving things through, they're not absorbing things properly. Maybe we have where, again, the muscles aren't working properly. And then also, as it exits on the other end, you also have nerves in your lumbar spine and pelvis that also control that function. So if those sphincters aren't working properly, that could actually be a nerve issue. So usually when it comes down to it, when I have patients that are having digestive issues, especially children, we need to make sure that their nerves are working at 100% function so the body can do what it's designed to do and push things through and process those properly. So that's the number one thing I see issues within kids is they have nerve pressure, whether that's from the birth process, whether that's from playing sports, whether that's from roughhousing, or just being kids jumping off of couches and playgrounds and things like that. We can have pressure on those nerves from an injury that can cause those nerves not to work properly. The number two thing to think about is we also have muscle function, not just muscle function in our mouth with chewing or muscle function in our esophagus, which pushing that food down to the stomach. We also have muscles in our stomach that help to churn up that food so we can break it down properly. And then we also have muscles all the way down the tube and at that sphincter exit as well that are also controlled by nerve function. So if those muscles aren't working properly or if there's nutritional deficiencies going on, so I'm going to bring up a couple of these. So when it comes to nutritional deficiencies, your body uses vitamin D. Yes, vitamin D, I'm talking about that sunshine hormone. Vitamin D is actually used not only in immune function, it's used in muscle function, as well as mood balance, as well as bone density. It's used in a lot of different things. So vitamin D deficiency can cause issues where muscles don't work together properly. It can also cause issues where muscles on one side of the spine and one side of the core don't work evenly with the side or the other side, and that can cause not only spinal issues, it can lead to some problems with scoliosis, but it can also cause issues where the muscles in the digestive system aren't working together properly because it doesn't have vitamin D to help those work properly together. Another nutritional deficiency I see very commonly, it's probably about 70% of the population, is magnesium. Your body uses magnesium in 300 different enzyme reactions. It's used in digestive, hormone balance, muscle function. It's used in all the smooth muscles, everything from vascular to digestive system. It's used in literally everything. We also need calcium to contract our muscles and magnesium to relax our muscles. So if we're deficient in magnesium, we can see issues where we get spasticity and things aren't pushing and relaxing with those muscles. The other thing too is magnesium helps to relax the smooth muscles. So it helps to relax those muscles so they're not spastic, and it also assists with the contraction and relaxation process. So very important that we're getting enough magnesium. Typically for kiddos, I usually recommend about 100 milligrams twice a day if they're about 50 pounds. You can do more or less than that. Magnesium is water soluble. So once your body has enough, it comes out the other side more of a, for lack of a better term, soft serve texture. So if you're getting a looser stool, that usually means you've had too much at once. So if you're doing 100 milligrams, you might need to space it down to 50 milligrams and kind of do twice a day so it's spread out a little bit more, and make sure you're drinking plenty of water with that. For adults, the typical recommended daily allowance is about 350. So I usually recommend taking 400 so that your body has enough, and you again want to split those out. So 200 in the morning, 200 at night. If you're not having loose stool, your body may need more. I have some patients in my office that take 200 a day, and I have some that take 1,000 a day. What's really interesting is magnesium deficiency, in some cases, has also been associated with seizure disorders. So very important you understand magnesium is very important. So big thing, make sure we have vitamin D levels proper, make sure we have enough magnesium coming in. And another thing that I find a lot of times too is if we are deficient in electrolytes, so we need water inside of our muscle cells so those muscles can work properly. But in order for water to get inside, it needs salt so that it can actually absorb in, and we have that homeostasis in and outside of the cells. So I usually recommend when it comes to electrolyte drinks, 1 electrolyte drink per day. If you're not a fan of Gatorade or Powerade or any of the ones over the counter, there are plenty of recipes on how to make your own. I know at my house, I also freeze those into ice cube trays. So we have little ice cube trays we can use as well at our house. All right, so to recap, we got to make sure we've got nerve function. We've got to make sure we have muscle function. And to do with that, we also need to make sure we're getting magnesium, electrolytes, and vitamin D to help with that muscle function. So let's talk a little bit more about what we want to look at for better options, or options that don't require medication that can have some side effects that may be detrimental. So one of the biggest things, like I mentioned, is nerve function. So I always recommend getting a chiropractic check. You want to make sure your nerves are working properly. That doesn't necessarily mean you have to be adjusted, but you need to be examined to find out, do we have any issues where the nerves aren't functioning properly, where the joints aren't moving properly? Do we have arthritis going on that's corresponding and causing issues with nerve function? And then another thing that's really important is we want to make sure we are assisting and helping to try to push things through the intestines. So I also have a really great video called Tummy Massage. And that is really great because it goes through how to actually do a massage for the stomach and to help kind of push things through the intestine. You can definitely do that on babies. Adults can also benefit from it as well. Basically, what you're trying to do is you are trying to help move through that intestinal system. So in that digestive video I'm going to pop in with here in a little bit, you want to make sure that you are basically massaging up on your right side up to kind of the top of the rib cage, over towards the left, and then you're going to go down and out on the left. So I'll put a tag or like a video link at the end of this so you can watch that video. That is actually when Tori was like 6 weeks old. So she's so tiny in that video, which she's starting kindergarten in the fall. So it's an older video, but still great information. So I will pop that in at the end so you can see that massage video and what to do for that tummy massage. Another thing that's really helpful is bicycle style motion. So moving the legs where they're pushing up and putting pressure into the intestines and the muscles of your core is really important. It's also very important that we're developing our core. So if you have weak core strength, that can also cause issues with your abdomen not helping to stabilize and helping to kind of encapsulate that. And a lot of times we can see weak core can also correspond to hernia issues too. So very important we work on core for babies, making sure we're doing that tummy time, making sure that they are learning how to crawl and walk and lift their legs and lift their arms how they're supposed to. So making sure they get out on their own and they're able to activate that core, not always being held. For adults, same thing. You can work on core strengthening exercises as well as that tummy massage to help with that. The other thing to think about is we can also have some dietary issues where maybe your body is not really tolerating certain foods. I know the top two things that I see a lot of times in my office typically are going to be dairy products and any of your grains, so wheat and gluten. A lot of times people will have issues where their body just can't break that down properly and it causes inflammation. And when the intestines are inflamed, they can't work as well. So if you're having or noticing that when you eat certain foods, you're really struggling, or seems like any food you eat, you're struggling, you may want to look into food allergy testing. I know skin scratch testing usually only checks for like immediate responses. Most food allergies happen when the food is actually partially digested in the small and large intestine. So what I typically recommend is doing a food inflammation test. In our office, we have a quick test called the FIT. It is basically 5 drops of blood. We send it off to the lab. They actually will measure complement reaction and immune system reaction. So we know how severely you're reacting and what you're reacting to, and also what you're not reacting to. So we know what are safe alternatives for you to swap out so that you can still have a normal diet and you're not restricting a million things. The other thing is, I know I mentioned nutrition. There are a couple things you can do to help assist with the digestive process. I already mentioned magnesium. You can also look into ginger and chamomile and milk thistle teas are also great to do. I know for kiddos, a lot of times what I will do is I will put a little bit of honey in that tea as I brew it, and then you can add ice cubes or even milk or things like that to make it a little bit more tolerant for kiddos. It's also helpful if you have fancy straws. So I know at our house we have some rainbow colored metal straws that are reusable and able to be cleaned. Those go over really well, and pretty much anybody will drink it if we can stick a straw in it. So great tips if you got kiddos at home. Some other things we can also do is focus on foods that help to stimulate the intestines and also stimulate to make sure that things stay soft. So everybody knows prunes can help to soften stool. Apples and applesauce is also really great for that. Stone fruits like peaches, plums, and pears can also be helpful. And then also berries, so cherries, blueberries, strawberries, any of your berries and stone fruit can be really helpful for that, and grapes too. So those are some things that you can try helping with your kiddos or yourself eating on a regular basis to help keep that stool soft. So hopefully you learned something today. Like I said, for a recap, we want to make sure we have nerves function. We want to make sure we have muscle function. We want to make sure we have the right type of nutrition, and we want to support our bodies, not necessarily with only medication. So I'm going to do a little overview of that again so that you have that information. So I will pop in right now with that so that you can watch that video. Check this out. So we have up here in our mouth, we have our teeth and our tongue that helps us to actually break down and chew the food, and then we swallow it down our esophagus, and the muscles of our esophagus push that down all the way to our stomach. If you see, we have muscles that line the inside of the stomach, and we have a mucus coating called mucin that actually protects the stomach from ulcers and stomach irritation. Your food is broken down further in the stomach, and then it's actually pushed down into the small intestine. So it goes down through the duodenum as well as the jejunum, all the way down into the small intestine, which is that kind of pinkish color right in the center. And that's where our body absorbs most of our nutrition, our salts. It basically just tries to save as much nutrition as possible. After it goes out of the small intestine, it goes out here into the large intestine. It goes up, and then it goes over and down and out the anus. So that is basically an overview of your digestive system. Now, I know I mentioned that nerves can be a big factor here. So we actually have nerves in our upper neck that correspond with function of our jaw and how we chew. We have muscles, nerve function in our upper back that controls our esophagus and the muscles that push the food down into the stomach. Typically, we have muscles at that, or not muscles, but nerves at that T6 level and T7 level that help direct function of the stomach. So right in between your shoulder blades of your spine, those nerves come out to tell the stomach what to do. We have nerves typically between T7 down to T9 that help control the function of the small intestines and the liver and the gallbladder. So you're breaking down your fats and also breaking down anything you're eating. And then our lower back, typically between L1 down to L5, we have intestinal function from the small intestine, the large intestine, coordination of the muscles of our core that help to push things through the intestinal system. And then we have our pelvis or lower back that controls the muscles that help with voiding and pushing that out the other side. So lots of different things can happen. Either we may have issues where the system's not working, it's not getting proper nerve function, it's not moving properly. We might have some hormone imbalances that could be impacting that, but a lot of problems can happen in the digestive system that can impact and cause anything from food allergies and having to go to the bathroom very frequently, very quickly after eating, to also constipation. So very important to realize that the nerves of our spine actually signal these organs to work properly. So if the nerve signals are not being or sending those signals properly, that can cause issues where the stomach doesn't break down our food properly, doesn't make enough stomach acid to break it down. We may have issues where the intestines are not getting proper nerve signals, so they're not pushing things through, or could be pushing things through kind of abnormally. So rather than kind of pushing through the digestive system all the way through, it kind of randomly, it'll contract in one area, another area, instead of pushing it all the way through effectively so it connects it properly. So that's definitely some factors that can cause digestive issues in kiddos. I know constipation is one that we see very commonly in kids, and that has a lot of concerns for parents. So I just wanted to make sure we go over kind of how that system works. Thank you for watching today. Hopefully you learned a ton of information and some things that you could be doing at home to help your kid or help yourself with constipation issues that does not rely on medication. Also, if you've been having issues and you've already talked to your primary care, if they've done any lab work or if they've done any stool sample testing and they have not done a microbiology test, that's another thing that can be really helpful. It's actually a stool sample test that tests to see, do you have enough good bacteria and what else is growing? Is it possibly pathogenic and causing irritation or even leaky gut style symptoms? So that is a test that we offer in our office as well. But for the most part, we want to make sure that your body has everything it needs. And if we are not getting answers, we might need to do some further testing with the food inflammation test or the microbiology test to get answers for you. So have a great rest of your day. We'll see you next week.